It is my pleasure to present Phase 2B Multicenter study on MR-Guided focused ultrasound focal therapy for intermediate risk prostate cancer. My name is Behfar Ehdaie, and I am presenting this on behalf of my co-authors. Approximately 40% of men randomized to active monitoring underwent radical treatment within 5 years. This was a study that was done in the United Kingdom on the heels of a prostate screening study in which patients who were diagnosed with prostate cancer were randomized to radiation, surgery, or active monitoring or surveillance. Based on these results, in a prospective study of men monitored with active surveillance, a large proportion of men required treatment. We sought to develop and test a procedure to delay radical treatment in men with localized intermediate risk prostate cancer using focal therapy. MR-guided focused ultrasound was delivered focally to grade group 2 or grade group 3 prostate cancer lesions with a margin of normal tissue exceeding 5 millimeters. Patients with concurrent grade 1 prostate cancer foci were untreated. The clinical trial schema is presented below. All patients underwent a multiparametric MRI and an MRI-targeted and systematic biopsy prior to enrollment. Then patients were consented and underwent Exablate MR-guided focused ultrasound. Subsequently, patients were monitored every 3 to 6 months with serum PSA, exams, quality of life surveys. At 6 months, all patients underwent multiparametric MRI with MR-targeted and systematic biopsy. This was repeated again, mandatory as part of the protocol at 24 months with MRI with MR-targeted and systematic biopsy. The Exablate 2100 Prostate System is a transrectal MR-guided focused ultrasound device that delivers energy into the prostate from an endorectal phased array transducer. As depicted here, patients are placed on the MR table and under general anesthesia. A probe is placed in the rectum, and the patient is brought into the MRI bore, and imaging and treatment is then started. Initially, the tumor is identified on T2 weighted images, and the ablation zone is marked in the system program with an appropriate margin of treatment. Then the system automatically plans sonication map for the treatment duration. Finally, acoustic energy is sequentially titrated to temperatures sufficient for tissue ablation exceeding 60 to 70 degrees Celsius, guided by real-time MR-based temperature feedback of the treated region and anatomic information. After treatment, a subsequent MRI with contrast is completed to demonstrate the ablation zone and provide effectiveness of the treatment area. The primary endpoint of the trial was absence of grade group 2 or higher prostate cancer in the targeted region or whole prostate gland at 6 and 24 months using MR-targeted and systematic prostate biopsy. The secondary endpoints were change in baseline patient-reported quality of life outcomes 24 months after treatment. We used validated surveys that measured sexual function, erectile function, overall quality of life, urinary continence, voiding function, and overall prostate cancer health. The results are depicted. Overall, 101 patients were enrolled. 198 patients were eligible and were subsequently excluded for various reasons depicted in the eligibility and exclusionary criteria of the trial. The median age was 63, with a median PSA of 5.7. Importantly, approximately 79% of patients were grade group 2 and 22% of patients were grade group 3 disease. The duration of treatment median was 110 minutes. At 24 months, 88% of men had no evidence of grade group 2 or higher prostate cancer in the treatment area. We see the breakdown of the targeted region biopsy at 6 and 24 months. Again, patients with grade group 1 disease in regions of the prostate gland were left untreated, and we focused our treatment in regions with grade group 2 disease. Of note, we included an in-field recurrence or persistent disease as cancer detected on the targeted biopsy or the same region on systematic biopsy. At 24 months, 60% of men had no evidence of grade group 2 prostate cancer anywhere in the prostate gland, including cancer detected outside of the treatment area. As we can see, the grade group breakdown included small volume grade group 2 disease in patients who subsequently chose to either be treated or undergo surveillance. We also evaluated patient-reported quality of life. Importantly, we used a conservative definition of functional erections defined as an international erectile function score greater than or equal to 24 on a 30-point scale. As we can see in the depicted figures, we divided patients between those that needed PD-5 erectile medications and those that did not. Overall, in Figure A, we see 70% of patients at 24 months had functional erections without the need of erectile medications. If we allowed erectile medication utilization, 90% of patients reported functional erections at 24 months. When we evaluated urinary continence using the International Continence Questionnaire, no patients reported incontinence or pad utilization for stress urinary incontinence. The success of this trial, placed in context of other trials that were done in focal therapy, demonstrate that first, this was the first trial in which 6 and 24-month biopsies were performed on patients based on protocol mandatory biopsy. In other studies, the outcome was measured within 12 months on a single prostate needle biopsy or based on a combination of biopsy or imaging characteristics. Looking at the data from various forms of both thermal and non-thermal focal therapy, targeted biopsies in the region of treatment demonstrated disease-free between 10 and 95%. Of note, 96% of our patients at 6 months had no evidence of grade group 2 or higher prostate cancer in the targeted region. In conclusion, the landscape of focal therapy technology continues to expand, and clinical trial data with intermediate-term outcomes demonstrate focal therapy effectively treats select prostate cancer patients and achieves superior functional outcomes compared to surgery and whole gland radiotherapy. MR-guided focused ultrasound with real-time thermometry achieves a superior in-field success with excellent functional outcomes compared to ultrasound-guided treatments. Data supports offering focal therapy as a viable treatment option for select patients with prostate cancer. Thank you.